Hi, I'm Dr. Keemberly Kim, and I'm a board certified dermatologist with fellowship training in Mohs micrographic surgery and cosmetic dermatology. And I'm based at the Westlake location in Houston in West University. And thank you so much for joining today. I know that lunch is precious for many, so thank you for spending your lunch with us. I'm going to be talking about what I consider probably one of my top three favorite laser treatments today, the UltraClear Laser. So I'll briefly cover the technology of the laser and how it works, if you're a good candidate for this treatment, sort of what to expect from a treatment, and then I'll go over a few patient cases, some examples, and then end with a brief Q&A session. So feel free at any point during the presentation to submit questions, and then I'll try to go through as many as I can within our allotted time. I do encourage you to stay until the end. You might find that there will be a surprise that may end up being beneficial if you do decide to go with a treatment. All right. Oh, sorry, we're running into some difficulties here. I think we were on the wrong slide to start with. Okay, there we go. We're all set. Okay, so like I said, I was briefly going to cover the technology of the laser, but before I do any of that, I kind of have to talk about how lasers work and briefly review sort of the lasers and how they've worked in the aesthetic industry and in dermatology. They've actually been around for several decades. They offer a variety of options for addressing different skin concerns, but not all lasers are the same. They use light energy at specific wavelengths and have specific targets in the skin. So many of you might have heard about the CO2 or the erbium laser. They're ablative lasers that target water. We have water in all layers of our skin, and using laser energy, we deliver heat into the skin in a very controlled manner. And we destroy either that most superficial layer of the skin um, while simultaneously delivering heat energy in the deeper layers of the skin. And this is what's going to stimulate that production of new collagen and elastin fibers. And this is what's going to lead to skin tightening and rejuvenation. So if we go back to the 1990s, that's when we had the development of the CO2 and erbium YAG lasers that were used for ablative skin rejuvenation. This revolutionized our ability to make old skin look young again. These devices were really powerful, really effective. However, they could have some side effects. They could be riskier, and they did require longer recovery times and could be a little bit uncomfortable. We jump forward to the early 2000s, and that's when we had our mid-IR lasers, and they were developed, and you might have heard of non-ablative and fractional ablative resurfacing, and that took hold then. Really great devices, much safer, and they required less downtime. However, we weren't getting the same results that we were getting with our fully ablative lasers like the CO2 and erbium lasers. So if only we could have a device that could be effective, yet safe, and have less downtime. So that's where Aclaro jumped in 2018, and they founded the 2910 cold fiber laser, the device, the UltraClear. They came out with this device that allowed for significant results with less downtime and, more importantly, less risks. And in 2022, it was launched. It was cleared for the treatment of fine lines, wrinkles, age spots, scars, skin resurfacing, and more recently for the treatment of benign pigmented lesions and for the treatment of redness. So what makes the UltraClear unique is the way in which it delivers the energy into the skin. So prior lasers would deliver the energy in a single pulse, and this could cause more collateral damage to the surrounding skin. So what's going on with the UltraClear is that they are using these micropulses and delivering the heat in multiple smaller pulses that allow us to treat the skin with less risk of damaging the surrounding skin. So all in all, what does this mean for you as a patient? This means that there's going to be less discomfort, less downtime, and less risk with significant results. So are you a candidate for UltraClear? Well, if you're looking to treat any sort of uneven tone, texture, fine lines, wrinkles, any sort of scars, if you have pigment concerns, sun damage, or if you just overall want to start a sort of pre-rejuvenation routine, this is going to be a treatment for you. You're very likely going to be a candidate. And patients are liking the UltraClear laser because it's very comfortable. It uses its, like we said, cold fiber technology, makes it more comfortable, less downtime, less pain. And it's very safe on all skin types. It also allows you to address multiple skin concerns in one single treatment session. And it can be very quick and convenient depending on the type of treatment that you choose. It's versatile, so as I said, you can come in with multiple concerns, and I'm able to treat multiple concerns all at once with one treatment. And it's a treatment option for all skin types. So, like I said, prior lasers were riskier in certain skin types. Now we can treat anywhere from fits 1 to fits 6. And it's appropriate for all ages. So anyone coming in from their 20s up, and I've treated patients up until their 80s. And then there are different levels of treatment. So depending on what your concerns are, we can either start with a very superficial treatment. So more superficial treatments are going to have less downtime, and they're going to address overall skin health, tone, texture, any sort of sun damage or pigment. And they typically will require multiple treatment sessions, but most patients will see results after that one treatment. And then for your moderate and advanced treatment settings, we can treat deeper wrinkles, acne, scarring. There will be slightly more downtime, but again, results are seen after that one treatment session. And then this is a nice depiction showing the different levels of treatment that I can offer with the UltraClear. So your 3D Miracle is going to treat the very top layer of the skin, and hence less downtime. Your UltraClear and laser coring features are going to allow us to treat deeper into the skin, deeper wrinkles, slightly more downtime. What to expect from a treatment. So I like to have every patient come in for a consultation. We can see sort of what treatment is right for you, what your concerns are. We'll take photos that day. And then we'll also talk about sort of what to expect pre-procedure, how to prepare for it, and then post-procedure, what post-procedural care is going to look like. The actual day of the procedure, you're going to come in, and depending on the procedure that you're getting, you'll either receive some topical numbing, and the treatment can last anywhere from 15 minutes to an hour, again, depending on what area we're treating, how aggressive we're going. And then here's a video. I wanted to share this with you all. This is a 3D Miracle treatment. So this is one of our more superficial treatments. But notice how our patient's very comfortable. She's talking through the procedure. She had no numbing prior. So this is going to be your lunchtime laser treatment. And then a little bit of a closer up here. This is also your 3D Miracle. Patient had no numbing, very comfortable throughout the entire procedure. We're delivering laser pulses very, very superficially into the skin. All right, so again, patient experience, recovery. Most patients are very, very comfortable from this procedure. I would say I just had a patient this morning who was telling me that she wanted to do one again, and she had one 3 weeks ago. That was very comfortable. Again, it's going to depend on the treatment, the type of treatment that you receive, whether you're going to receive topical numbing or not. With your 3D Miracle, there's going to be little to no downtime. With both procedures, you'll leave with some slight redness. You'll sort of feel like you have a sunburn, and then depending on how deep or aggressive we go, you might have some superficial sloughing for a few days or up to a week. I would say most of my patients have fully recovered after 1 week of treatment. And so this is your 3D miracle. This is sort of what to expect. You'll have some redness immediately afterwards. You'll feel like you had a light sunburn and then some light exfoliation over the next couple of days. And for our more aggressive treatments, like if we're treating a full face for sort of acne scarring or deep rhytids or wrinkles, you'll leave looking red. You'll have some redness that day, maybe the following day. You might have a little bit of swelling, but overall, this patient's fully healed a week out after treatment. Okay, and so now I'm going to go over a couple of the patient cases. I'll try not to take too long on these so we can answer questions at the end, but if at any point you feel like you have any questions, just submit them and I'll get to them at the very end. So we're going to go over the 3D miracle treatment. So this patient had a 3D miracle. Again, this is the most superficial one. Typically, most patients require no numbing. And even after one treatment, she had significant improvement in her pigment. This was 1 month out, and even improvement in her redness. And then this is a younger patient, also had a 3D miracle, 1 month out, significant improvement in her pigment. You can see that her cheeks look a lot more even toned here, and she just has an overall glow. Another 3D miracle, this patient had 3 treatments, and this was 1 month out after that 3rd treatment, but overall looks more glowy, more even toned. There's some improvement even on the acne scarring that she has on her cheeks. And as you can see, it's safe on all skin types. Another treatment, or another patient with a 3D miracle. This one's pretty impressive, significant improvement in the redness and as well as all the sunspot, the lentigines on her cheeks. And then we're not limited to only treating the face. You can also treat the neck. Significant improvement in this patient's tone after just 1 treatment of the 3D miracle. Okay, so for our more moderate treatments, we can treat pigment with this laser. So this is a clear treatment, and this was 4 months post 2 treatments. So that's pretty impressive. And then also our more moderate treatments with clear and significant improvement after just 2 treatments in her pigment. I believe okay. And like I said, we're not limited to just the face. We can treat neck, we can treat hands. We know that lots of times we forget about our hands and they also give our age away. But it's a great treatment option for those who want to treat sunspots on their hands. And then for our acne scarred patients, this is also a great treatment option. This is just after 1 treatment. You can already see significant improvement on the scars that she had on her cheeks as well as tone. And this is a slightly more aggressive treatment, but definite improvement in the sun damage she had, as well as, definitely improvement in the fine lines, wrinkles, and overall just looks more rejuvenated. Also, after 1 treatment, definite improvement in the fine lines. And then this one you got also an UltraClear treatment. This was just 1 treatment. Pretty significant improvement in her acne scars as well as fine lines and pigment. That lentigine is completely gone after that 1st treatment. And then this was a series of treatments, but like I said, we could also treat the neck for those of us who have any sort of wrinkling or any sort of loose skin that you want to treat on the neck. Also a great option. And like I said, we treat patients of all ages, all skin types. I actually had the pleasure of treating this cute little guy during my fellowship training. He'd come in with a traumatic scar, and as parents, we worry, is this going to affect them, their self-esteem? But we also worry if we treat it, is it going to be painful? And this patient came in, we put a little bit of topical numbing. Grandpa held him in his lap, and we were able to treat it, and he didn't even cry. And look, he's totally fine after treatment. He's happy when he followed up. And this was the 2nd picture, was right before he had his next treatment. And you can see, he wasn't even crying knowing that we were going to laser the scar again. And then This patient had significant improvement in his acne scar. You can definitely see on his cheeks. Those acne scars can be pretty tricky to treat sometimes. So I'm really excited to be able to offer this for our acne scar patients. And then finishing up here with our more aggressive setting, the laser coring. If you want to treat any sort of sagging or sort of this gel area, can be very difficult to treat. And you also want to treat fine lines and, like I said, pigment all at once. This is a great treatment. We can incorporate some laser coring, which is basically us delivering slightly larger holes and slightly more aggressive settings that allow for more significant skin tightening. So definite improvement in overall her texture, but look at that jowl area, significant improvement in her pigment. And then these perioral lines can be really tricky to treat. So this is pretty impressive after just one treatment. I believe this is the same patient as well. Oops. Okay, so now we can go ahead and answer any questions that we may have. Oh, we've got quite a few. Okay. Okay, so is this procedure going to hurt? So it really depends on the settings that we're using, what we're addressing. Most patients, like I said, tolerate the procedure fine with without numbing or with topical numbing. I think pain is very subjective, but for the most part, I have not had any patients complain about the procedure being intolerable or having to stop the procedure. And if you're ever someone who worries about pain, we can always go ahead and do topical numbing, even if we're doing a very superficial treatment. Then how often do I require this treatment? So it really depends on what we're trying to address. I would say that most patients will see a significant difference after one treatment. If you want to go ahead, I don't like to tell patients like, oh, I think you're going to need this set number of treatments in order to see results. I like to just see sort of how you respond after that first treatment, and then we can go from there. Now, for the more superficial treatments, like your 3D miracle, if we're going to be treating pigment or any sort of fine lines, those typically will require more treatments to see further results. Okay, so what's the timing between treatments? So I like to have patients usually give their okay. I like to have patients wait about 4 to 6 weeks before treatments. That gives your skin enough time to recover, and then your skin actually starts to form and make collagen during that time. But even if you wait longer than 4 to 6 weeks, you'll still see continued improvement and results then. So there is no set time frame. I would say 4 to 6 weeks is usually the minimum, but if you want to wait longer, you might even continue to see improvement then. Okay, is the improvement permanent? So yes, the results are permanent. That doesn't mean that you won't continue to age. We all will continue to age, and you may need maintenance treatments in the future, but it's not sort of like your neurotoxins or your filler where you have, they either wear off or they dissolve. So they are permanent. And then does laser coring require more downtime than other settings? It may. So I will say that so your 3D miracle, like I said, is a more superficial treatment setting. If I'm treating more of those finer lines and wrinkles or any sort of scarring, I will incorporate some of the deeper setting, the UltraClear or the laser coring. And the downtimes typically, most patients will be typically fully healed by a week out. However, you might have a little bit of residual redness or erythema, especially with the laser coring. So it all depends. Everyone has different sort of definitions of downtime. But 1 week out, you'll be able to wear some light sunscreen or makeup to cover any residual redness if there is any left. Can you still get Botox and Juvederm with treatment? And then I had someone else who asked a similar question. So is this going to replace my Botox or filler? So not necessarily, because we're addressing different things with Botox and filler and lasers. So your Botox is going to smooth any sort of lines and wrinkles that are formed on movement with facial expressions. Your filler is going to provide structure, support, and volume. And your lasers are going to sort of treat any sort of textural abnormalities or textural concerns, skin tone, or pigment. So it's not going to replace those treatments, and I highly encourage you to continue those other treatments in addition to your laser treatments. Let's see. Is downtime related to appearance, or is it necessary to facilitate the healing? So downtime, yeah, so like I said, downtime's sort of a subjective thing. You know, I've had patients who come in, most of them will leave red with the more superficial treatments, and they're totally fine continuing with their day. I've had patients who come in and they have a more aggressive treatment, and you have some pinpoint bleeding, you might have some swelling, and they also are totally fine going out in public. They don't care. But if you're the kind of person who just doesn't want to have to deal with, you know, having that redness or any sort of pinpoint bleeding, I'd say maybe it's the sort of procedure where you're at home for that same day, maybe the next day. But after that, all the swelling will go down and you'll just be peeling and have some sort of sloughing. How long? Oh boy, there's so many questions. Yeah. How long do you have to wait if you get filler? It's not the kind of procedure where you can get filler the same day. If you want to do, you can either there is no right or wrong answer. You can have filler before, but you could also have filler afterwards. I'd say give it the 4 to 6 weeks, see what results we have. And then if you want to add on some filler then that would be a good time. Okay, one last question. Let me see if there are any sort of recurring questions here. How often? I think I had a lot of questions about how often we should get the treatment. I mean, a lot of these questions are pretty similar. I guess a lot of people ask about post-procedure sort of healing and aftercare. So we'll definitely have you come in for a consult if you have any sort of questions, specific questions related to your aftercare, but we'll usually discuss them during that first consult. After the procedure, we'll put some cooling gel, and then you'll go home and you'll do vinegar soaks for the next few days. And then you'll also apply some Vaseline to sort of help speed up the healing process. I am a big fan of like the post-procedure products. I'm happy to chat about them during the actual consult, but none of them are actually necessary. It's just that I do find that they make healing a little bit quicker and more comfortable for certain patients. For those of y'all who did stay until the end, all consults for this procedure are complimentary for the month of April. And if you do have any questions, feel free to reach out. And any attendee who did attend the session today will receive a 20% off their entire treatment as long as it's booked during the month of April. It doesn't necessarily have to be in April, but if it's booked by then you'll be eligible for the discount. Again, thank you everyone so much for joining. I know lunch is precious, so I appreciate your time, and just feel free to reach out if you have any questions.